All right. Well, I think we can go ahead and get started. So good morning, good afternoon, and good evening, everyone. Thank you for joining us for our July of 2021 Global One Health Initiative webinar, supported by the NIH Fogarty International Center. Today, we will be hearing from Dr. Deborah Thompson of One Health Lessons and Dr. Cheryl Stroud of the One Health Commission. Dr. Thompson is only available until 9 a.m. So we will give a brief she will give a brief presentation and then answer several questions before having to hop off. And then we'll hand the platform over to Dr. Stroud. And after Dr. Stroud has presented, we will open up the panel discussion. And Dr. Thompson has two interns, Doris Ma and Madison Burns, that will serve in her place for panel discussion. So I'd like to go ahead and briefly introduce Dr. Thompson. Dr. Thompson is a veterinarian and One Health advocate who served as a science policy advisor in the United States Senate and as consultant for the University of California, Davis, as well as nonprofit One Health focused organizations. She's currently leading a global organization called One Health Lessons that inspires children and adults to value the interconnection between human health and the health of the environment, plants, and animals. And she's also recently authored The Art of Science Communication, Sharing Science with Students, the Public, and Policymakers, which is a book available on Amazon. And she also has a new book about science communication that's coming out this month, which we're very excited to hear about. So with that, I will hand it over to you, Dr. Thompson, and thank you so much.
Thank you so much, Dr. Binkley. Really appreciate being here and having this great opportunity to have such an important discussion about One Health communication. Well, thank you, The Ohio State, for putting this on. This is, like I said, an incredibly important topic for the world, and it's a pleasure to be with you all. Today, we are going to be talking about the art of One Health communication, and I am Dr. Deborah Thompson. Today's game plan. Let's just set out the strategy for today. It'll be in 4 steps. 1, review the widely used One Health communication techniques of various governmental organizations or nonprofits or private sectors throughout the world. Then we need to consider the trajectory of One Health actions. Are there going to be more or less in the future? Then we're going to explore projected difficulties for One Health advocates around the world. And then we're going to discover some solutions together to those challenges. So that's the game plan. Let's get started. You may probably have seen this plenty of times from the US CDC, as well as a lot of other agencies affiliated with the United States government. It goes like this. One Health's definition is a collaborative, multi-sectoral, and transdisciplinary approach working at the local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. We probably are very well acquainted with this definition. How much of the general public do you think would be able to understand this definition, especially after a single reading? Next, let's explore some infographics. Some of these infographics are really, really wonderful, but think about who the target audience is. You've probably seen these before because we're all One Health advocates in this room. But think, is anything on this screen too complicated for somebody who has never heard the term One Health before? Next, when I saw this particular infographic, I fell in love with it. As a scientist, I thought that it was all encompassing. The One Health approach, it has a lot of different variables and components of One Health in there, and it's not the typical Venn diagram as One Health typically is described. But is it too complicated for the general public? And why do we need to have buy-in from the general public? Well, as I'm sure you have noticed, in the last year, in the last 2 years, even in the last 10 years, there has been substantial increase in the chatter, and not only chatter, but actions of One Health advocates around the world. And that I am completely grateful for. But really, what does tomorrow look like? We're going to explore together a few different stories, and these are true stories, and we'll explore where the trajectory is going to lead us. This first story is taking place in Washington, D.C. And this is the area where I live in, and this is me down in the front with the purse. I started the AAAS, so American Association for the Advancement of Science, the AAAS Science and Technology Policy Fellowships One Health Affinity Group. That is such a mouthful. What you need to know with that is that with the American Association for the Advancement of Science, that organization has a subset dedicated to getting more and more doctors of various backgrounds, either PhD, MD, DVM, DMD, the list goes on and on. As long as you can have doctor in front of your name, then you are eligible for this policy fellowship. And I was fortunate to be afforded an opportunity to work on Capitol Hill in Washington, D.C. with the federal government. I was working in the United States Senate as a policy fellow. And with this affinity group, with this One Health affinity group, I created it with Jennifer, featured here right in the middle. She's a microbiologist. And then if you think about everybody else in this group, we have an ecologist, we have a social scientist, we have a physician, we have an epidemiologist, the list goes on and on and on. Really, One Health in action to bring people from all these different backgrounds together and explore an incredible exhibit at the Smithsonian Natural History Museum in Washington, D.C. And the person who I was able to lead us through this tour of the outbreak exhibit at the Smithsonian was not only but Dr. Dan Lucy. Dr. Dan Lucy, in case you're not aware, this exhibit was his brainchild. This exhibit was his passion project. And this exhibit would not have existed if it wasn't for Dr. Lucy, who is a physician, an infectious disease physician. So he was fantastic, and he was able to give us a great in-depth tour for about 3 hours in this exhibit. And I'm sure Dr. Stroud will be talking about this a little bit more. We had some fantastic conversations throughout this exhibit. Keep in mind, everybody in this group has either a PhD or a doctorate of another kind. So I found it quite funny when a +1, a spouse of one of these participants, one of these AAAS fellows, I asked who he is with, and he said, "Oh, I'm with Dr. So-and-so." And even though this was on a Saturday and we're all casual and we all know each other by our first names, I had to laugh inside because we were all doctors at that space because it's AAAS, and that's the way that fellowship went. Long story short, the target audience for that conversation, for that tour, was really for people who have been in school for a very long time. But think about what the general public who's coming around the corner in this picture would think about the exact same stimulus, about the exact same exhibit. Well, that leads us to thinking about our target audience, okay? If we're speaking with other scientists and getting them interested in One Health, then we can possibly have more and more One Health actions, which is wonderful. Maybe not to the same degree as how we have been in the last 12 months or 18 months, because the pandemic has certainly shed light on One Health, but I see a great future there. The other thing that's important to realize with this AAAS Science and Technology Policy Fellowship is that there are several dozen fellows on Capitol Hill, where I was, and I was working in the legislative branch, helping craft bill language and other type of developments in the One Health space. But over 200 other people were working throughout the agencies, places like NIH, National Institutes of Health, and USDA, the United States Department of Agriculture. And USAID, the US Agency for International Development. So there are lots and lots and lots of people who are starting to become One Health advocates who are in these different agencies. But how much power do those agencies have? Let's think about another group of people who attended the exact same exhibit in Washington, DC, about 2 months afterward. And that was a group from Capitol Hill, meaning policy people who are crafting laws, people who are crafting avenues for funding of certain activities, such as One Health activities. And so these projected, the trajectory, unfortunately, after that meeting was substantially lower in future One Health actions, because honestly, the scientists who were leading the exhibit were speaking past the policy staffers. And because I've lived and experienced both sides of that conversation, I could see where the ships were missing each other, right? So ask yourself, out of these two groups, who yields more power? Is it the people who fund the agencies, or is it the people who are at the agencies who distribute money to all different scientists in order to advance research and help public health and global health? Well, this takes us back to knowing the target audience, right? The exact same stimulus, the exact same presentation was given in two different places the exact same way. It was not received the exact same way. So when you were speaking with politicians, okay, when you're speaking with people in federal government or state government or local government, who do you think would be more honest in their feedback of your presentation? That's a tough call. Now add into that question, if you start to communicate with children, do you think children would be honest in providing feedback? Do you think that they would show you signs if they would either be bored or if they don't understand what you're saying? And this is the whole point of exploring the importance of One Health communication. If you can truly explain in an efficient manner your niche knowledge to a 6-year-old, to an 8-year-old, you will then be able to attain such skills to craft your message and have it efficiently delivered to the right people of substantial power and influence. So whatever your One Health goal is, my personal goal is to inspire every child and adult on the planet to value One Health. And the way you can go about your goal is the way I'm going about my goal, is from the top down and the bottom up, grassroots. But keep in mind that that's not the only way to address a problem. You have to find solutions in all different ways. And the interns with One Health Lessons, the organization that will be discussed later on with Doris and Maddie, those interns know that I am all about taking detours if there is a hindrance in the way of us achieving our goals. So if you don't remember anything else, remember that there are at least 3 solutions to communicating efficiently with people of power and of significance who can change your funding of your project, change the funding of your university, change the funding of your hospital. But taking into account policy and using that example, you can attain individual policy experience through various means. You can start to work on science communication skills by actively seeking out conversations with people outside of your professional bubble. Outside, I'm a veterinarian, so me speaking with people outside of veterinary medicine. And you can also practice and learn communication techniques in safe environments. And what I mean by safe environments, places where there's no judgment, places where it's okay to stumble because there are people who are going to be helping you improve your communication skills. So thinking back to that CDC definition is very thorough, but here's a question for you. How can you explain One Health in less than 8 seconds? The way I explain is with 2 sentences. One Health concept is the interconnection between our health and the health of the environment, animals, and plants. And Maddie and Doris can also speak with you about how we can adjust that language depending on who the target audience is. Then the One Health approach, what is that? It's teamwork. In one word, it's teamwork. It's teamwork between people of various strengths, disciplines, and backgrounds to prevent and solve complicated problems. This is how you can explain One Health to a 6-year-old or an 8-year-old or a 10-year-old or a 14-year-old, and it just goes on and on. I would not necessarily say interconnection. I would just leave it straight out as connection. And I would not say plant health. I would just simply have a picture of a plant to represent environment. And we talk about what is the environment? Oh, it's your surroundings. What else is in your surroundings? Things like water. How is water important in a person's health and an animal's health? And we have a discussion. Now, we ask them also, what is the One Health approach? And the way we explain this is teamwork between people who care, who have empathy, who care for our health. Instead of saying public health, human health, we say our health to show and build a relationship between you, the speaker, and the audience, and the health of the environment, animals, and plants. We take this message and we translate it. Right now, the lessons available at onehealthlessons.com are being translated into over 80 languages today. And it also meets the needs of cultures, subcultures. And I wanted to leave you with this message that there is an opportunity for you to safely and with monitoring and privately improve your One Health communication skills. And Doris, who will be attending later on in the meeting, will definitely be able to walk you through these different steps. You see, this is a Train the Trainer program that's affiliated with One Health Lessons. And the whole point is to make sure that scientists, engineers, science advocates around the world can improve their science communication skills, because ultimately, do you want to rely on a science translator, or do you want your message to be really translated by you, the scientist? So to become a volunteer lesson leader, feel free to take a screenshot of this screen right now, of this slide, and you can contact that email address. Now, going forward, I have written a book. It's called The Art of Science Communication. The subtext is sharing science with students, the public, and policymakers. So everything that we have discussed and more is included in this book. It is a rather short book. I did that on purpose, so that way it can be accessible to you in your briefcase, in your purse, in your backpack, and you are more than welcome to highlight, scribble, share notes, and have open discussions with people of various backgrounds. And that really is taking One Health in action. Thank you very much, and I'm very happy to be here. Thank you for this opportunity. And in order to purchase the book and also pre-order the book, just go to Amazon, type in my name, Deborah Thompson, Deborah the long spelling, Thompson the short spelling. And I'm happy to answer any questions for the last 3 minutes or so. Thank you very much.
Wonderful. Thank you so much, Dr. Thompson, for your time and wonderful presentation. This is so critical to everything we do in One Health, and it is so important for us to think about as we implement and promote One Health in action. So if you have a question, if you could please enter it into the Q&A box, we will go ahead and get started on questions for the next 10 minutes. So thank you. I have one question, at least to start with. So what do you think are, I guess you've sort of already addressed this, but the biggest challenges when it comes to communicating, especially across cultures, yeah, to a general audience, perhaps in a different culture?
Right, excellent question. Certainly when you add different cultures, it makes the preparation extra long, right? But that's fine, because learning about different cultures and understanding how different cultures work and how people work in different settings is the essence of communication. You have to do that background research. Now, certainly if you're speaking with a group from, say, Southeast Asia versus a group in Africa, you have to approach those audiences a bit differently. You have to engage them differently. And that's honestly a conversation that I'm happy to give. I think it would take about an hour, to deliver that talk. But the most important thing is when you approach people from various cultures, be the person who is actively listening in that conversation and analyze how somebody's saying something and what they're saying and who they're referencing. Is there a power structure in the group that you're speaking with? And if so, who is the most influential person in the group? And you need to have them on your side in order to help move people in the direction that you want them to and understand the reason for it. So ultimately, it comes down to doing your homework.
Excellent. Thank you so much. That's a wonderful approach. All right, we have another question from Dr. Stroud. She says, well, I could unmute you, but she says, we scientists are terrible at sharing our work with the public. What can we do to help scientists become comfortable stepping out of their labs and finding ways to better relate to the general public?
Yeah, thank you so much for that question. It's it is an occurrence that happens around the world, right? We as scientists, we have been in school for so long. We have surrounded ourselves with like-minded individuals for so long. We are comfortable with our own jargon. But how far will that get us? That will get you to the outskirts of your bubble, but not beyond that. And I hope in this presentation, you could see why it's important to get out of that bubble, right? In order to advance science in a way to create public buy-in, public support for your efforts, you need to make sure that the public receives the information accurately and timely. And so your methods could be to hire somebody who can translate for you, or you can take it upon yourself to attain these skills and be actually the spokesperson for your own work. Now, what are the steps to get you comfortable in stepping out? Certainly becoming a lesson leader with One Health lessons and being trained to be able to communicate with people of various age groups, various backgrounds, will certainly help. I also truly recommend attending a Toastmasters International meeting. Those Toastmasters groups, if you have not heard of this, it's a public speaking group. They are in over 100 different countries around the world. They're in lots of different languages, as you can imagine. Just go to toastmastersinternational.org and you'll find some more information about them. But that is a safe place where you can present an idea, a scientific idea. You can try to explain your research, explain your niche knowledge, and see how it lands. But make sure that the majority of the Toastmaster speakers, the other Toastmaster members, are non-scientists. I know growing pains are hard, but in order to improve your message, in order to advance your career, in order to advance your research and your work as a scientist or engineer, or more, you need to be able to reach outside of that bubble and communicate in a way that's approachable to the general public.
Wonderful and so true. All right, do we have any additional questions? Let's see here, we have one. As a fellow on the Hill, did you work more on advising or drafting actual legislation or on developing policy on conducting day-to-day business of congressional offices and committees?
It was more the first. Right. So I was working on drafting legislation, drafting bills that could possibly become laws. That was my main goal. But I was also working towards in the office, crafting messages for various agencies, various federal agencies, and help them realize what actions are important to Congress, the funders, right, in the science world. So say, for instance, things like when it comes to the pandemic, because I was on Capitol Hill during the onset of the pandemic, asking various federal agencies about certain protocols that had been started at that point, and seeing if more expansion of those protocols are worth considering, and opening up that conversation, but coming from Capitol Hill, and particularly a quite powerful office on Capitol Hill. So my behind the scenes work was really pushing the envelope to advance science in order to improve public health and global health on a real level.
Wonderful, such a fascinating experience, I'm sure. All right, I think maybe we have time for one more question if anyone has one. All right, one more here. Hello, Dr. Thompson. My question is, since we are living in a global pandemic, how does communication of One Health take place?
Excellent question. Well, look at where we are today. I am in Washington, D.C. Dr. Binkley is in Ohio. Doris is in Hong Kong. So certainly online conversations are the safest, physically safest, right, way to go about communication. So that means making sure that through social media, through other means of your influence, your power as a One Health advocate, you understand the power of social media, you understand the power of various avenues of delivering a speech or delivering a message, and take it one day at a time. Now, when the world opens back up safely, then you can start to build even more meaningful relationships with people from different backgrounds, with people of different levels of influence, right? But now's the time to get your name out there as a One Health advocate and try to start a conversation online. What does One Health mean to you? Once again, the world opens up, then you'll be able to build upon those conversations and actually put them in action at the community level and beyond? So great question. Thank you for that.
Excellent. I think that's a wonderful one to end on. So thank you so much again for your time, and we'll let you get back to your clinical duties, but it's been wonderful discussing with you, and we hope to hear more from you in the future. So thank you so much.
Thank you so much. I'll leave you all in very good hands with Maddie and Doris. They are phenomenal interns with One Health Lessons, and I'm happy to be sharing this time with them, as well as Dr. Stroud and Dr. Pinkley. Thank you again, everybody. Take care.
Thanks so much. All right. So now I would like to go ahead and briefly introduce Dr. Cheryl Stroud. Dr. Stroud has professional experience in industry, academic research and teaching, private veterinary practice, and as a One Health practitioner. In 2010, she was instrumental in creating the North Carolina One Health Collaborative, chairing its steering committee for over 3 years and facilitating collaborative formation of an interinstitutional One Health course titled One Health, Philosophy to Practical Integration of Human, Animal, and Environmental Health, cross-listed at Duke, UNC, and NC State. Dr. Stroud currently serves as Executive Director of the One Health Commission, with her primary focus being on educating communities locally, nationally, and globally about the urgent need for One Health implementation. She shares the concept and updates about the global One Health movement with audiences around the world, seeking to connect One Health stakeholders into action teams, strategic networks, and partnerships that can educate about the full scope of the critical need for One Health thinking and acting. And with that, I will hand it over to you, Dr. Stroud, to begin.
Thank you, Laura, and thank you to GOHi. I've been watching what GOHi's been doing for years now, and I'm really excited to be part of your webinar today and congratulate you on all the initiatives that the Ohio State GOHi program has in place. So I bring you greetings from the One Health Commission. We'll talk a little bit about what the commission does. I always like to start a presentation with my thank you to organizations that financially support the commission. We could not do any of what we do without that financial support, and finances are always a challenge. So again, I would like to, I'll start out with a very gentle reminder, because I know I don't need to go into it with this group, about the full scope or all the arenas in need of One Health. We'll touch briefly on some of the systems challenges that put us at risk. We'll touch on the international One Health movement, some of the players in the space, and I'll share with you some resources that are available to you and to the world from the One Health Commission. You know, as Deb pointed out, that definition that we often see is very much too much complicated for the public, and I don't have to go into the definition at all with you guys, but I will point out that as Deb and I are trying to arm you with information and ideas about communicating One Health, just bear in mind and actually point out that it's a very ancient concept, but it is a new professional imperative. If we stay on our current trajectories, we as mankind and our planet may be doomed, because we're on some really unsustainable trajectories right now. So again, you need to kind of boil down your talking point, your 8-second description for a 6-year-old of what One Health is. I sometimes say it's a way of thinking about how connected we people are with the animals and the plants in our environment and with our planet, and thinking of the planet as a living organism. And this is just a handful of all the logos that are more like the typical Venn logo, but logos that just a handful from organizations all over the world. And we'll touch on a few of those very, very quickly. I'm often shocked when I am trying to speak to the public that the general public doesn't even know what the term zoonotic disease is, much less knowing what the term One Health is. So I always have to, frame my comments and tell, if I'm talking to a general audience, tell them what a zoonotic disease is. A disease that passes between humans and animals, and give them some examples they might be aware of. The one that the general public still doesn't realize, that HIV/AIDS was started out as a zoonotic disease. And then, of course, the general public is probably very aware of Ebola. And of course, now we're living in this pandemic, and it's so much more urgent that we learn how to do this communication with the general public so we can take that top-down, bottom-up approach that Deb was mentioning. And there are so many incredibly urgent needs for us to take this message and to implement it, to really make One Health the default way of doing business. This is just an example. A person dies every minute from tuberculosis in India, and it's estimated that over 20 million cows in India have bovine tuberculosis. And so there is no way we're going to eliminate human tuberculosis without controlling bovine tuberculosis. And the examples that we could bring forward to people, even boiling it down to their own space, there are so many examples. I'll just point this to you in case you haven't seen it. Please go on YouTube and search Tracy McNamara and look for her Canaries in the Coal Mine video, because she's really addressing comments to the US because we have no CDC for animals, we have no biosurveillance for companion animals and wildlife. And she's on a personal vendetta, a personal mission to try to help us get to that. But one of the statements in there that just blew me away was that our current funding structures, this is a quote from Tracy, our current funding structures are the opposite of One Health. They virtually guarantee that we will not find an emerging zoonotic threat until we have people in emergency rooms or bodies in the morgue. In other words, our current systems have us using humans as the sentinels for diseases rather than paying attention to what, we could be paying attention to animals as sentinels for what we're being exposed to. So that was just my segue into reminding us that there are so many arenas beyond zoonotic diseases that really are begging for us to use this One Health approach. Starting the concept of making us aware and paying attention to animals as sentinels. Think about the animals as sentinels for vector-borne diseases and the things in our environment. And we were actually looking at the blood in dogs, and the Flint, Michigan led in the water crisis because it was sentinels for what the humans and especially the children were being exposed to. And of course, we all know antimicrobial resistance. I'm not going to read through this list because this is a One Health literate group. But zoonotic diseases is really at the last of the list because there's so many arenas that are begging for us to use this approach. And I know that your GOHi webinar series has really addressed that. That have forced us into silos are things like our publication system, where most research around the world is funded on public tax dollars. But most of the research results for many years was only published in journals that only people who were members of professional associations that owned and operated the journals had access to. This is still a challenge. Open access is really helping us, but we have to very diligently protect the quality of the publication systems. So that's just one of the systems that have forced us into silos. And then what Deb was talking about, these language barriers, these acronyms that we as scientists are so comfortable speaking to each other in acronyms, that especially the older of us find it very intimidating to go talk to somebody in another profession because, oh, they might use an acronym that I don't know and I have to ask what they're talking about, and that would be very embarrassing. So silly little things like that get in our way too. And as we pointed out in the previous discussion, our inability to communicate with the public as scientists is one of our major challenges. So that's, I guess you could think of that as a system of us climbing into our silos. So what can we do? We all in this room understand the urgency of this, but what can we do about it? So let's just talk about a few things that are being done, and maybe you'll get some ideas. Maybe you want to start something local in your neighborhood. Here at the One Health Commission, we work very hard to, let me just go back to that. We work very hard to connect One Health stakeholders so that they can create teams and networks that work together across professions to educate about One Health and One Health issues. On the connecting front, how do we do that? We've been working for about 7 years now to try to identify all the groups and organizations around the world that are actively leading for One Health. And we've got them on a map now, and I'll just warn you, I've got to update the pin map, but the list on those pages on the website are very up to date. We had to break them into academic and government and nonprofit and private because there's so many organizations. In fact, we can talk about it a little bit more, but I just want you to be aware that we do that connecting of all those groups by putting out this One Health Happenings newsletter, and we gather information from all those groups. And this is where the communication skills have been so incredible, because I literally have met or have contacts or have communicated with someone from most of those organizations, so that we can start sharing, what's going on in my region for One Health. There's really nobody was doing that to help us shine a light on all that's going on around the world for One Health. And this becomes incredibly important when you start sharing it with policymakers. In fact, I was having a conversation with one of our senators one time, and I said, other countries are doing One Health better than us. And he kind of set up like, really? Because they're just not aware. So I urge you to go on the Commission's website if you're not already getting this newsletter, and go over here to Resources Services and pop over to the Join the Global One Health Community Listserv. And if you have any news coming out of your sector or your region or your part of the world, please share it with us. At the beginning of the One Health Happenings newsletter, each issue, there is a link to show you how to go and share your news. It's free to the world, and we hope everyone will use it. I just want to hit some of the things that you might not be aware of, some of the players in the One Health space. In Washington, D.C., starting back in 2006, and we won't really go into the founders of it, although it's a fabulous story. There is a One Health Academy group. They're not a formal nonprofit per se, but the Commission's been fortunate to be able to provide webinar platforms since about 2014. They've been having monthly health sessions for years, and I'm very proud. My former intern, Blair Budd, now leads that group. So if you would like to get on their listserv and be able to follow along with their discussions, it's a fabulous place to be able to interact. If you actually get to DC, try to find out if they're doing one of their meetings. They actually meet, when they do meet in person, at the American Society for Microbiology building. So I'm just going to share with you some of the highlights. Most of you will know Bruce Kaplan and Laura Kahn and Tom Manath, and formerly Jack Woodall, and we've just lost Lisa Conti. It's very heartbreaking. Who lead the One Health Initiative, another group that's not a formal nonprofit, but have launched their website in 2008 and have done an incredible job of really helping around the world, or helping people understand what One Health is and why it's so urgent. And then back on the in a global aspect, the USAID's Emerging Pandemic Threats program that started in 2009. You can literally see it on the One Health Day map where those efforts were focused in Central and Southeast Asia, Central and Southeast Africa and Southeast Asia. And that's been a phenomenal thing to watch. The other group that has had a huge impact in Southeast Asia is the Massey University One Health Fellowship Program, which I think has sunsetted now, but you can literally see on the map the outcomes, the trajectory of the way some of those programs were initiated and One Health was taught and taken to those areas of the world. Of course, I mentioned the CDC One Health Office that was started in 2009 by Carol Rubin, is now led by Casey Barton-Baravish. Most of you will know her. I hope you're taking advantage of some of the resources that they provide, doing a fabulous job with their Zoho calls and their infographics that they're trying to teach the public about One Health with. But what I want to point out to you is that I've actually had a board member, had a federal representative asking, well, what's the big deal about One Health? Isn't CDC doing it? And this kind of set us back a little bit, because there is no line item budget, anything in the US federal government for One Health. We have a long way to go there, and we'll hopefully talk about that a little bit. There are many people within our agencies in our federal government that understand One Health and try very hard to work and function in a One Health way, but the systems are just not set up to support it. There's actually a US federal interagency One Health working group that was previously led by Joe Anelli out of USDA. It is now led by Casey out of CDC, and they've kind of retitled it the US One Health Federal Interagency Network. So this is incredibly important work that that these people within the agencies who are trying very hard to think and act in a One Health way as best they can without a formal structure in place, which we're hopefully going to get eventually. Of course, the One Health tripartite, the FAO, OIE, and WHO have actually recently been joined by the UN Environment Program, and they have created this One Health high-level expert panel. They've just announced the 26 people. And so these agencies have pledged numerous times to work together. It's sometimes a little bit easier said than done, but that's a critical, on the international front, it's a critical knowledge to know that they are working together. Other groups that have had a huge impact are the Network for Evaluation of One Health. When their funding sunsetted, they actually became the Network for EcoHealth and One Health, so they're part of EcoHealth International now. They've created this fabulous little handbook on integrated approaches to health, and I understand they're currently writing a textbook, and I'll mention another fabulous textbook in a moment. So that's another group to watch and become familiar with and see what they're doing. In 2015, the International One Health Platform emerged. The group that was leading it actually started back in 2011, leading International One Health Congresses or World One Health Congresses. And then we partnered, the One Health Commission, the One Health Initiative, and the One Health Platform partnered to create One Health Day back in 2016. The One Health Platform has this year, in the past few months, has closed its doors. And that's news to a lot of people. That was a huge shock to me. I mean, it was a shock to the system, but to lose these partners, I could just hear this great sucking sound in the One Health community, the global One Health community. But I'm here to assure you that One Health Day continues and the international congresses continue. The one in 2022 is in Singapore. I don't know what will happen beyond that because it was the One Health Platform that was organizing and making sure those happened. So I just wanted to make you aware that we have, that we've lost that strength in the One Health community, but I promise you One Health Day and the congresses will go on. I also want to just mention the Planetary Health Alliance. A lot of people think that we're in competition. The planetary health movement, our field, is very, very parallel to One Health, but not quite the same. And some people get confused and think it's the same. So they focus mostly on the human environment interface. And I work very closely and we try to support each other as best we can. But probably you would never find the planetary health people talking about comparative medicine or translational research or the human animal bond. So we're not quite the same, but we all, my goodness, we all need to be pulling together and synergizing our efforts and trying to support each other because what they're doing and the focus they're doing is incredibly important. I'll also make you aware that there's a One Welfare parallel movement going on that started back in 2016. I've met Dr. Garcia Pinella, who's been leading that. And so she's not focused so much on biodiversity, which is really emerging as critical to our health, the health of humans and animals. But she's really focused on the welfare of animals and how treating our animals better and making sure animal welfare is in place is also critically important. And it's kind of a parallel movement. Again, we need to be synergizing our efforts. So just make you aware of that. Over the past year or so, the Lancet One Health Commission out of University of Oslo has also emerged. In case you're not following that, they've done some really excellent webinars and have some emerging programs for youth and fellows training youth. So making you aware of that group, because that's what I do, is I try to find out who's doing what and how do I connect us and help us find ways to synergize. Just make you aware that back in 2017 and again in 2019, our G20 nations heard about and actually endorsed and included One Health in their reports. The Chatham House over in London has been leading One Health initiative since about 2011. So many people are not aware of that. So that's a very exciting thing to know that the communications coming out of there are also very positive. And then there's just this year, Dr. Ghebreyesus, I never can say his name, Ghebreyesus of the WHO made this statement that I literally put in One Health Happenings. For many people, One Health may have once seemed simply a concept. It is no longer. We cannot protect human health without considering the impact of human activities that disrupt ecosystems. And so he actually promised that they'd be discussing One Health at the G7 and G10, and indeed they did. In fact, you might have seen this commentary on the seismic shift when the G7 did bring up and discuss One Health and recognize One Health as critical to everyone's health. I have to tell you though, some of the scientists in the One Health space are concerned that we're still just at the rhetoric stage. And so what we've got to find is ways to really make it turn into actions, implemented default way of doing business actions. So just making you aware of some of these things going on in the space. One of the most exciting things I've been able to be involved with is watching and helping supporting development of the International Student One Health Alliance. And so starting back in 2017, and this is the current group, although I understand we actually have Neil Vizot is back in the seat for Secretary General now. So just making you aware that if you have students that are, students that are working for One Health, make sure that they're involved in this group. That I am so impressed and so privileged to work with all these young people. They give me such great hope for the future. So making you aware, they actually have a fabulous mentorship program in place, and they do a similar thing in their who's who and Students for One Health, so trying to identify where student groups are. And how wonderful is that if you have a student that's going to travel to another part of the world, once we get out of this pandemic, to be able to connect with students who are in other Student One Health chapters. So that's been really fun to watch. And then we made a webinar back in 2019 to start shining a light on all the One Health activities in South America and Latin America. And it's just been phenomenal to watch how it has turned into the One Health Latin America, Ibero and Caribbean network that is really helping connect the Spanish speaking and the Portuguese speaking world. A lot going on for One Health that I had no idea about because of the language barrier, because I have no Spanish. So that's been really exciting to watch and be part of. And because I work at the 70,000 foot One Health communication level, I get to watch the development of new groups. So right now there's a brand new group that's just been launched in the Balkans, the Balkan One Health Network. And then, in a moment, we'll talk about some of the countries that actually have national One Health strategic plans and platforms in place. And then, I get to see that we have a launch of a new One Health and Implementation Research Journal coming out of South America, and the launch of a new global One Health environment learning module. We do try to queue up teaching resources and learning resources for faculty like yourselves to be able to draw on. And then, by the way, there's this great, coming out of the World Health Organization, there's this great new game called Plague Inc. that a bunch of scientists and gamers got together and put this game together. So it's really incredibly powerful to see some of the tools that we can use in the communication space. And this is that list of countries. I know, forgive me, this is a very ugly slide, but this is kind of our working draft of the countries that have One Health strategic plans in place. And this will eventually turn into a web page so that we can point to this and show the world that there are countries that are really trying to do this in a very real One Health action implementation way. So I'm just give you a heads up to watch for that, because it's going to be really powerful for us sharing with policymakers. Turning the lens back on the US, just very briefly here. We were able to lead two webinars, a webinar series back in 2019, because we had become aware of many public health departments around the US that were trying to lead One Health initiatives from within their public health departments. So we brought them together so they could share some of their best practices and their challenges. And that was very informative. And you can actually go and listen to those, or you can see who the speakers were and dip into their slides if you're interested in seeing what some of those initiatives out of public health departments across the US are. That was a very fulfilling exercise, and wonderful things have come out of it. And across the US, the state of Washington, the state of Iowa, and Louisiana have actually had One Health declarations or One Health Month declarations. And not too long ago, New Jersey passed a bill creating a New Jersey One Health Task Force. I know Pennsylvania right now is trying to decide how to formalize their One Health Task Force. And there is a Northeast Regional One Health Consortium that has been meeting now for a couple of years. I've been following their progress, and it's made up of representatives from Pennsylvania, Connecticut, Delaware, and New Jersey, and maybe some other state. So, just to make you aware of some of the things that are going on, because I know we get so focused on our own everyday work. I'll just mention briefly that on the One Health legislation front in the US, the first thing I was aware of was back in 2015 when Senator Al Franken and 5 other senators sent a letter to the Obama White House urging him to create a national One Health platform and a United Nations One Health platform. We're not going to have time to drill in on any of these. The One Health Commission also sent a letter to that effect. And then in 2016, there was a One Health bill introduced into the US Senate that really just, these things take time. And so we're looking at years of trajectory here to try to figure out how to make this happen. So that was the first bill that was introduced. And then in 2018, it was introduced again in the Senate, a One Health bill. And then you'll all be quite aware, I'm sure, that in 2019, the One Health Act of 2019 was introduced. The first time it was introduced, well, it hadn't been previously introduced in a bipartisan way, but it's the first time it was introduced in both the Senate and the House. Unfortunately, it didn't get out of committee and the pandemic hit. And now we've got a lot of lawmakers going, oh my God, is that what you were talking about? So in 2019, we were able to form a U.S. One Health coalition, very informal, and you'll notice that the Ohio State University Global One Health Initiative is part of that group. And so that's been very rewarding to try to share information and keep everybody kind of aware of what's going on. Then, of course, most of you will be aware that on March 18 this year, that same One Health Act was reintroduced. There are actually a number of bills, we're not going to go into them, that either mention One Health or should have mentioned One Health that are about global pandemic preparedness and things like that. So, and I understand there may be more bills coming that could be really worthwhile, but just giving you kind of an FYI, this is what is, has been introduced right now in the US at the federal government level. So some of you may or may not be aware that the National Academy of Medicine at National Academies of Sciences, Engineering, and Medicine has a very active One Health Action Collaborative, and they've had a number of initiatives where they've gathered information and tried to raise awareness about One Health and One Health education. This is a paper they wrote on core competencies. If you're interested in core competencies, on the Commission's website under What is One Health, there's a drop-down menu there. You'll find a whole compilation of papers on core competencies. And I just recently found some more to add to it. So just go and check the Commission's website out. There are a lot of resources there that you might find useful. Some major organizations are beginning, AVMA has always, AVMA helped launch One Health Commission and has been a huge, strong voice for One Health since the early 2000s in the US, but other organizations like the American Public Health Association, they actually have a very beautifully written One Health policy statement now that you can find on the website. You have to just search for policy statements in 2017. And then just in the past year, for years, they've had a veterinary public health special interest group that was trying to bring One Health more strongly forward in the American Public Health Association. And they have just renamed that special interest group. A special interest group is a group of people with members within APHA, but it hasn't grown up and hit the critical mass to become a section within APHA yet. They've just renamed this veterinary public health special interest group. They've just renamed it the One Health Special Interest Group, and they have a really nice newsletter that they're also doing. So just making you guys aware of some of the things going on. And I don't often mention this, but more and more corporate entities are embracing One Health. Zoetis has for years, as you know, it's an animal pharma company and has really supported One Health in a huge way with dollars for many years. And Elanco, really came into the One Health realm a few years ago. They led a One Health antimicrobial resistance workshop. Others like SIVA and Boehringer Ingelheim and Galaxy, which is here in North Carolina. It's a Galaxy Diagnostics. It focuses on vector-borne diseases. Huge One Health proponent from the corporate world, and a company called Acor that's been working on finding ways to disrupt biofilms and thinking of that as an alternative to having to use antibiotics. So just making you aware that more and more corporate entities from the for-profit world are really starting to become strong proponents for One Health. And I'm so glad Deb told the story she did about the outbreak exhibit. I hope most of you are aware of this. What you might not be aware of, this exhibit was launched in the Smithsonian Museum of Natural History. As she said, the idea was Dan Lucy's. It was launched in 2018. It was supposed to close this year, but they've extended it. It's not going to close. I think last I heard was like November of 2022. So you've got time to possibly get to DC, but if you can't get to DC, or you know somebody who would like to use this, there's actually a version that travels. I'll make all these slides available to Laura afterwards if any of you want to go and look at any of the links that I've provided. But you can actually, one of these links will actually connect you with or I can do, if you want to reach to me, I'll connect you with the people of the outbreak exhibit. It's a pop-up exhibit. They're like 15 panels. I think they're working on one now for COVID-19. And you can bring this to a mall or a hospital lobby or a university library or a public library, or just bring it to some space in your region and set it up. It's actually traveled all over the world, and it's really, if you go and look at the information they've shared, it's so exciting to see how people have set this exhibit up in their areas in Afghanistan, Pakistan, and China and India. So that's very exciting, and I really want you to be aware that you could bring it to your area and actually host it and be the scientist standing there to answer questions in lay language to help the public understand this concept and this urgency. Now, it is all about zoonotic diseases, so it's not going to touch all the faces of One Health, but very important. So just briefly, very quickly, we've talked about the listserv and the One Health happenings and our who's who. If there's any organization that's not on that page that you think needs to be there, please let me know. We also run a One Health Opportunities Bulletin Board online. And the beauty of this is that not only can you go and look at opportunities from certificate programs to summer programs to internships, and I think I need to add one on webinar series, because that more and more One Health webinar series are coming up, but you can submit it. If you know of an opportunity, you can go here and actually submit it, and it'll show up immediately on the bulletin board. So I urge you to take advantage of that resource for those of us working in the One Health space and beyond. We have a very active One Health education group. We were able to be involved in launching a One Health for One Planet education initiative, which was international. This is the One Health in the US arm, and doing things like teaching children and parents that bats can have rabies, don't touch bats. We have a survey in the field right now for teachers, for K-12 or primary, secondary teachers, to try to help them begin to understand this One Health concept, because we've got to get our teachers, this is the communication and the finding the tools and the mechanisms to get this communication into the arenas where it's needed, and getting this concept to our K-12 teachers could be so incredibly important. So I know I'm about out of time. I want to make you really aware that we've been compiling. I actually started doing this because Peter Rabinowitz out at University of Washington had set up his Center for One Health Research, and he had local teachers and high school groups wanting to come visit him in his center. So he asked me, are there any, are resources out there that could be grabbed for K-12 or primary, secondary teaching? And it turns out there are. So we've been compiling them on a web page. There are actually a very long list of resources, including onehealthlessons.com, a very long list of resources that most of them are free and open to the public that you could grab, or if you knew a student who wanted to take some a lesson into an elementary school, could go and grab and use some of those. And then also on that opportunities page, we have been at the bottom of that page queuing up higher level, higher education level, One Health education opportunities and resources. And there's so many of them out there. We're still discovering them and trying to at least put them in a place where you could find them, because one of the challenges is these wonderful things exist and they're out there, but nobody knows about them. So until we can find a way to communicate what's out there and help people understand what is available and what things they could tap into, we have a lot of work to do. And then one of the really critical and important things that we've realized is that we've got to get more social scientists involved in this conversation. And we have a very active One Health Social Sciences group that's been trying to do that. They've been leading fabulous webinars and actually engaging more economists and anthropologists and clinical psychologists and behaviorists to really understand this One Health concept and to really become more active in this. So if you're interested, I urge you to get involved. They have their own little listserv that the Commission supports, and also share information through the Commission's One Health happenings. So just making you aware of some of the resources that I hope some of you might be interested in. We have a pretty extensive One Health library. I just want to point out, well, first of all, there have been by now it's probably over 115 webinars that the commission is either led or co-led or supported. And that listing of all those webinars is available in this library on the webinars page. But I really want to point out to you, I'm just kind of cheer for this book that Sharon Deem and her group out of the St. Louis Zoo put together, because this Introduction to One Health book is put together as a textbook. So, I mean, complete with chapters like introducing the person who knows nothing about One Health to One Health concept, complete with questions at the end of the chapter. So I urge you to be aware of and use that if you have opportunity, or if you know people who are teaching, or if you have courses there at your university that might like to have access to a book like this, just making you aware of it. And then this is a little bit unconventional, but when the pandemic hit, we were realizing there were so many popular media op-eds and commentaries that were showing up about the pandemic that were mentioning or calling for One Health, that we literally started queuing them up on the commission's webpage. Now, the eyebrow was raised from the scientific community, because I know they often look down their nose at popular media, because sometimes they get it wrong. But these are curated items, and this is what the public reads. This is where the public is getting its information. So I just wanted us to see there are well over 250, starting in January 2020, well over 250 of these articles that were showing up in popular media. And we actually engaged one of the reporters that wrote one of them, Jimmy Tobias. We recently did on June 30th, we did a One Health 101. It was really targeted for the public. And we had Jimmy, who was a reporter who just discovered One Health after the pandemic hit. We had him speak. And it was very powerful to have someone who's used to speaking to the public to really tell a story that could, just an illustration of the One Health thinking and the One Health philosophy. So go and check that out if you're interested. Don't let your eyes glaze over. There are a lot of articles there, but it's a pretty impressive list of articles. There's also, we've queued up a whole list of the economic benefits of One Health. If you see any that are missing that really need to be here, I beg you to let me know. I'll just shine a light on this particular publication that we ended up publishing on the One Health Commission's website. It's by Olga Jonas, who had worked for over 25 years with World Bank. And she makes a very powerful case for what happens if we don't pay attention and fund preventive measures, complete with the dollar signs about how SARS has cost us $40 to $54 billion with the magnitude of the impact. And I just have seen recently that it's thought that possibly this COVID-19 pandemic is going to cost the global economy up to $85 billion over 5 years. So, if the loss of life because of us not paying attention to this won't really get our attention, maybe the dollars will. So just making you aware that you can go and check that out. We did launch, and I wish I had time to tell you the story about how this started. It actually came about because of Deb Thompson's fellowship and her ability to really make a One Health Awareness Month declaration happen in the Senate for January 2020. And we launched this One Health Awareness Month for January. And then the pandemic hit, right? After we made that One Health Awareness Month. And so now we're having a One Health Awareness Month every January. It actually went global and the whole world has jumped on board. The reason I'm telling you about this is just so you're aware of it, but this is all communication strategies, right? These are things that we can do to help the world understand. And one of the things we did for this was so much fun. And I'm so excited because I've been wanting to do it, and I will eventually turn this into web pages, but we created this One Health Awareness Month campaign guide, where somebody who knows nothing about One Health could go through, or somebody who knows a lot about One Health could go through here and grab resources and share on social media. So if you click on this calendar on that page, it'll take you to a list of resources. And that's what's been really powerful. It's because it's videos and publications on the many faces of One Health, from biosurveillance to One Welfare, One Planet, to soil health, to chronic diseases, chronic and non-communicable diseases. So these are the many faces of One Health, and the information that's out there that we could grab and share to help everybody understand the many faces and the many arenas of One Health. We all know that none of us, no single profession, no single individual, no country, no region can have all the answers to our many global wicked problems, and that in our current systems, that the relationships that we need for the collaborations to meet these challenges head on are not just naturally going to happen. We're going to have to go out of our way and create the opportunities for these collaborations and relationships to be formed. And all of that is done by our ability to communicate what's going on, communicate the need, communicate the possibilities, communicate what needs to happen. And so I hope that something I've said here gives you some ideas about how you can use information that's available in your own space, and maybe giving you some ideas about how you can step out of your little science bubble and start reaching to the public. So with that, I'll close, and I'm sorry, I probably went a little bit over time, Laura, so I'll be happy to answer any questions to the best of my ability.
Wonderful. Please don't apologize. Thank you so much for your wonderful presentation. This really hits home for many of us and gives us so many important tools and resources for One Health communication and implementation. So thank you so much. So we can open up questions now for either Dr. Stroud or Doris or Madison related to either presentation. So thank you so much. And if you could again enter your questions in the Q&A box, that would be wonderful.
So come on, guys. I always judge how on target a talk was by how many questions I get. So somebody ask me a question.
Thank you so much. Great to see you, Dr.
Hi,
Stroud.
Wilson.
It's wonderful presentation and nice overview and compiling. And thank you for all the wonderful work you and the commission and everyone is doing. So we really appreciate it. All of us in the different states and worldwide doing some work. Greatly appreciate the various advocacy and all the teamwork. You outlined many of the issues. Great to see the momentum, and you're right. So far is really talking the talk, but just want to hear your thoughts on a couple of things. One is, what do you think it would take us? I mean, nothing more than a pandemic. I thought a pandemic will give lots of energy for really true commitment. The House bill, Senate bills being, appropriated with approved and appropriated into a budget, as well as global, the G20. There's been lots of talk, yes. What do you think will take us, and what should we all do to get to that level from the talking to really a true commitment? Any thoughts, discussions?
I think we just have to keep at it. I think we have to be gentle and perseverant. We can't get in their face or angry or make them angry, because once you get sideways with any of these entities that we really need to be helping understand this, they're not going to hear a thing we say. So we've got to be gentle and perseverant and persistent and determined and just keep delivering the message. And that's happening all over the world. And I think it's going to happen here, but it hasn't happened yet. I mean, as you are, and embarrassed, and it's just horrible to see that the United States is the reddest continent for the COVID-19 cases. It's just, this gets so difficult with so many political issues, from people making wearing a mask a political issue. We've got to find ways to communicate. And, right now we're seeing, like, what was it? The Surgeon General today announced an initiative to try to help people understand that getting a vaccine is what's going to stop this pandemic. So there is no quick answer to what you're asking, Wondrous. And many of us, as you know, we've been wondering this for years, and we're doing what we can as best we can for as long as we can, as strongly as we can, as gently but determinedly as we can. So I think our answer to that is just keep swimming, just keep doing it, because we can't give up. If we give up, who's going to do it? If we slide backwards, and I do feel that we may be approaching a tipping point globally for One Health, and maybe in the US, there are lots of pins on the map for One Health, you guys being one of them on the Who's Who map. I think showing the world and showing the policymakers all this momentum is really important. That's the reason I started doing it. Because if you look at a map and you see how many organizations are really supporting One Health, then you can get the attention of a policymaker. But the other thing that has to happen is at our local levels. We've got, as scientists, we have got to get out of our intimidation of talking to our lawmakers. And you don't have to get in their face. You just have to connect and say, hey, I'm a veterinarian in North Carolina. I would just like you to know that I really think this One Health concept is really important, and I would be happy to be a resource for you if you ever have any questions. You have to find ways. I am not a very political animal. I've learned how to do this in the past few years because I had never spoken to a lawmaker. I was like everybody, very intimidated, didn't want to go speak to a lawmaker. But it turns out they put their pants on one leg at a time, just like I do. And so we have to realize that, and what I have discovered is many of them are thirsty for the connections that we can provide as professionals, as scientists. They want to hear this, but they often don't have the mechanism or have a way to connect with us. And so it's really up to us to take the initiative, to reach out, to go, physically if you can, at least by an online meeting if you can, to actually make those connections, to get out of our little comfort zones and make those connections to help share this information and help them understand the importance of it. And then maybe we can start showing some grassroots effort, because it will be the general public that votes for these people that'll help them decide what's important. So I don't know, it was a very long answer, but I hope something there was useful.
Yeah, absolutely. I think we are all on the same boat, but yeah, you're absolutely right. But, considering now with COVID and with the pandemic, and hopefully we're getting out of the pandemic, which would be really great with vaccination, everything. My worry is the silver lining of COVID is really getting the attention. If you don't get the attention and then followed by a commitment with a pandemic, if the pandemic dies and we're waiting another few decades, I hope we're not sliding, but you're right. So we're at the tipping point, but I hope that momentum will continue.
Well, that's the reason I say if the loss of over 600,000 lives in the US doesn't get our attention, maybe the dollars will. I mean, that's really sad commentary on our global state of affairs. If the money would talk more than the lives, but that might be the deal. So if we can make noise about how much less it would cost to prevent these pandemics by implementing One Health thinking and acting and programs, if we put a One Health program in place in the US, that we have better coordination, more funding for public health, more awareness of some of these public health, these One Health issues, then maybe the dollar signs will help us understand that prevention is so much better. So
yeah.
What can I say?
No, you're right, absolutely. Yeah. Great. Yeah, no, thank you. So maybe something, I don't want to take much of people's time, but as the One Health Commission, kind of our central coordinator, something that always comes to my mind is really, for all of us, we can add value and momentum together. And like you said, gently knocking the door. At one point, I thought of you and Bruce and the different groups, all of us, when World Bank came up, Frank Berthe and the team came up with, it was 2018, I think, the economics of One Health, and few $1 billion could have prevented a major, pandemic, right? So, but the world is not even investing few $1 billion in collecting all the US is especially investing relatively higher, but still considering GDP, other things, not much. But maybe if the Commission coordinates, we all team up, including the World Bank, Frank, or your group and others, and knocking the doors. It's the G20 key leaders in a physical way, hoping all this virtual world will slowly change, knocking the door, making the case, and really getting commitment, I think would be good, but somebody need to coordinate that, and we will be happy to join hands, I can tell you. I mean, I'm sure in other universities as well, but as a commission, think about that. Maybe in the future we can discuss.
So Wanwason, you're really touching on something that is really very dear to me. I have been dreaming for years of creating a true global One Health Alliance, where all the groups around the world that are working on One Health, we actually not just learn about each other, which is a novel idea right now, because we're so fragmented, but not only learn about each other, but join hands and come together and see where our synergies are. And then we could speak in a unified voice. We don't have that yet. And that's part of the reason I've been working so hard on this Who's Who and trying to get us connected and opening the communication channels, because I don't know exactly how we're going to get there. The commission funding is such an issue for the commission that nobody listens to us because we don't have big dollar signs, right? And so it's the organizations that have big dollar signs and a lot of clout that will be listened to. But we are very happy to try to help coordinate. And, I even sometimes dream, sometimes you let your imagination run and I think, well, maybe the United Nations can help us do this. So, these are conversations that we really need to figure out a way to better coalesce through communication skills, to better coalesce and defragment the One Health movement itself. It's been almost self-defeating for us for many, many years because we don't have this cohesiveness. Yeah. And many people have, I hear this over and over and over again about how it's so totally unacceptable that One Health that is supposed to defragment us is so fragmented. Yes. So I would love to have a further conversation with you and anyone else that maybe we could put together a working group to try to find ways to do this so that we could better coordinate and do it together. So thank you very much for that comment. That's a very, very keen point in my heart.
Let's talk about that. Definitely have some ideas, but because then collecting the groups, and I think it will need knocking a door. See whether it's flying to Geneva or flying to New York or anywhere. But let's talk about that. Yeah.
Let's do. With this the One Health high level expert panel, that might be kind of an opening, a crack in the door for how this One Health tripartite plus now with the United Nations Environment Program added in. Maybe that is one thing that we could think about. I would love to talk about how we could better coordinate.
Let's do that. Yeah, I look forward to talking to you.
Great.
Great. Thank you so much. Yeah.
Thank you. Thank you. Wonderful to hear. So we do have a question. It is for Dr. Stroud, I believe. It doesn't specify. Maybe for both all panelists. What is your favorite One Health outcome, and can you share a great success story?
I would like the One Health lessons interns to take that first.
Okay, thank you so much. I can go ahead and take that. So one of my success stories that I have is a time that I was teaching one of our One Health lessons, and I was guest speaking at a classroom, an English learning classroom in the Ukraine. And I went to this classroom and all of these kids were English language learners. So English wasn't their first language, but they were all extremely engaged and extremely excited to be learning about One Health. And none of them had ever heard of the concept before. And so it was really great to see all of these kids really enthusiastic, really excited. A lot of them messaged me after the fact and told me that they loved the activities that we did. They loved the PowerPoint. They thought this was like one of the most interesting lectures that they had had in a while. And so to see all of the kids become so inspired and become so enthralled in not only One Health, but also science was really great to see. And I know that it really impacted them a lot. Thank you.
Wonderful.
And the other intern, do you want to say something?
Yeah, hi everyone, I'm Doris, and I echo what Madison just said. I was also very involved in teaching a lot of kids around the world about One Health with One Health lessons, and actually something that I guess you could call a One Health outcome, but is also an ongoing process is currently we have a program called the Lesson Leaders Program that Dr. Thompson mentioned a little bit in the webinar, but it is also extended now to an ambassadors program. So after you become a certified lesson leader, where you're all qualified and trained up to teach kids about One Health, and you teach five more lessons after that, you can become what we call an ambassador for One Health. And through that program, currently we do have a couple of people who are already certified ambassadors around the world. I know we have recently someone in Nigeria, also a previous intern named Charles, who just led a team of 10 people by himself in Nigeria through an in-person training. So he was trained to become an ambassador, and then he taught some lessons in Nigeria himself. And then now he is training the next generation, you could call, of volunteers who can then teach even more people, more students and more children about One Health. And they do this through over different languages, right? Because our program is currently offered in English, but we can see how when people can really come together from all parts of the world and then get trained in English and then bring that back to their country and train people in their own language, teaching the lesson in their own language with our translated lessons available on our website, that we can really reach this message could really reach people from all around the world. And I think that is just fantastic and a wonderful outcome.
Wonderful. It's so encouraging to hear. Dr. Stroud, would you like to go ahead?
Okay, so the question was, can I give an example of a One Health outcome? Is that what the question was?
Sorry, yes. So what is your favorite One Health outcome, and can you share a great success story?
Well, I have a couple of points that I'd like to make, because my favorite outcomes are some of the things that I shared with you. One of the points I'd like to make is that it's going to take a reframing of our attitudes, our human attitudes about our place on the planet, and appreciating science is part of it. But what One Health Lessons and what all of us are trying to do is to really start very early to start reframing those attitudes, because it's not going to happen if we start at the college level. We have to really start instilling these attitudes of an appreciation for our planet and biodiversity and the underlying themes of One Health on the zoonotic disease front, and some of the other faces of One Health is reframing our attitudes. So to see, just to see onehealthlessons.com exist, to me, is a fabulous outcome for One Health. But there are so many others too, to see all the organizations around the world that have embraced and understand One Health, and not only embrace it and endorse it, but go to work for it. All the organizations that are on the One Health Commission, the Who's Who page, they've not just written a letter saying, yeah, we support One Health. They're actually leading programs like onehealthlessons.com. They're actually leading programs to help with outreach and get more people to understand this concept. And so that's, to me, that's a huge outcome of this movement for 15 years. Because on the Commission's website, you can literally track under the events button, you can go look as early as 2001 or 2002, where there were maybe one or two things that happened in the year. You can literally track the progress of this One Health movement by looking at all the events that show up, and it's not complete. You know that. It's way incomplete. But when you hit like 2007, 2008, 2009, 2010, and then, it just really explodes beyond that. That's an incredible trajectory, kind of like Deb was showing, and that an incredible trajectory of the understanding of this concept. And that's a huge outcome. But if you want a specific, I'll give you a specific example. And Tennessee, I think it was Tennessee and Kentucky, there is a One Health awareness group in Kentucky that had kind of modeled itself after what Tennessee was trying to do through its health departments. And locally, they had noticed, I know we've got 1 minute, locally they had noticed every year there was a spike in EEE cases. And they couldn't figure out why every year there was a spike in these cases of encephalitis. And so they approached an entomologist, and this is their One Health group, right? They approached an entomologist and asked him, why do we see this spike every year? He said, oh, that's easy. The waterway that ran through there was controlled by the Corps of Engineers. And when they were controlling water levels, when the water level would hit a certain level, there would be an explosion of mosquitoes. Okay, this is a real life story. And so they brokered the conversation between the Corps of Engineers and the public health departments and the entomology, the mosquito control programs. And they implemented a program where the Corps saw that the water was going to hit at this magic level where the mosquito population was going to explode, that they would warn the public health and the mosquito control agencies so that they could implement things ahead of the mosquito explosion. So that to me is a very, very real life, tangible outcome of One Health communications and One Health connections and One Health strategies, that group in that public health department that was working, they call themselves Kentucky One Health Awareness, that they were actually able to help make a real life change. There are hundreds of stories like that. I've got books on my shelves that are case stories for One Health. Our challenge is getting those stories out where we can share them with the public. And that's a real challenge right now that I'm really struggling with, is how to get those stories out. You know, do we do it on YouTube? We'd love to run like a YouTube One Health Stories channel that maybe we can do together with One Health Lessons. So that's one of our challenges, is getting those stories out there so that people can see these critical outcomes and make them very real to people. So we're 1 minute over.
Oh yeah, no rush, but thank you. Excellent, wonderful questions and wonderful presentations. Thank you so much again. And we've had a very powerful discussion. So thank you so much, all of you, for Dr. Stroud in medicine and Doris, and then of course, Dr. Thompson as well, for wonderful presentations in time. So we look forward to next month when we will be having Dr. Sam Karaoke from Kenya Medical Research Institute present on his work on One Health AMR surveillance implementation in low, middle, and middle resource income countries. And so we look forward to seeing you then, and we hope you have a good rest of your day. And we will definitely be circulating the recordings and sending out Dr. Stroud's presentation as well, so you can look at some of these links and explore these different opportunities. Thanks so much, everyone. With that, we can close. Have a good day.
Thank you guys. Bye-bye.
Bye.
Thank you so much. Okay.